Now, family history used to be a quasi-gene test because they said, well, if it runs in your family, there's a likelihood you have the same genes, and so you have it too. Now, for some diseases where a genetic defect causes a disease in 100% of cases, so a very severe genetic defect, it sometimes makes sense to look at the family history. But many diseases that we talk about actually appear in or influenced by many, many different genes. And once you have 10 different genes that all have a good or a bad version, there are so many different combinations, and both parents will have a mix of good and bad genes. And then when they have a child, by chance, they give a good or a bad gene to their offspring. So the offspring can have way better genetics than the parents, or way worse because they inherited the worst from the parents. So once you look at such complex things where many genes are involved, a family history or a family tree really becomes very useless. So I would caution against looking at, well, diabetes runs in my family, so I don't need a gene test because there are many genes involved, and inheritance in these cases is very complicated. So in most cases, you really need to look at the gene sequence or do a DNA test to find out what your situation is.